Now, the World Health Organization, WHO, yesterday declared the monkeypox outbreak a public health emergency international concern, rather a public health emergency of international concern. Even though there was no consensus among members of the WHO's emergency committee on the monkeypox outbreak regarding their advice on the determination of the PHEIC for the disease, the global body boss, Dr. Tedros Adhanom, insisted that the multi-country outbreak of monkeypox constitutes a PHEIC. He said that the measure was in recognition of the complexities and uncertainties associated with this public health event, and having considered the views of committee members and advisors, as well as other factors in line with international health regulations. He said, quote, "We have an outbreak and that has spread around the world rapidly through new modes of transmission and about which we understand too little," end of quote. Tedros said, adding, "For all these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern." Now, the global health body issued temporary recommendations to different groups of states parties based on their epidemiological situation, patterns of transmission and capacity, stressing that the temporary recommendations are expected to be implemented in full in respect of established principles of human rights, inclusion, and the dignity of all individuals and communities. Now, joining us to talk more about this monkeypox, we have Dr. Samson Shonowo. He is the medical director of Shonowo Hospital. Good morning, Dr. Samson, and thank you for joining us on the show this morning.
Good morning, Margaret.
All right. Now, let's talk about monkeypox. It's been declared as an issue of concern. Let me use the word, a global pandemic. Let me get your thoughts on it as a medical practitioner.
My thoughts on it. Well, to summarize what the whole public health emergency of international concern means, is actually like it's more or less an extraordinary event that poses a public health risk to other states through international spread, and it requires, that's the major criteria there, it requires a coordinated international response. That means wherever it originated from, that particular country where it was endemic can no longer control its spread, and it will require coordinated response with other countries. That is when a disease is declared as a public health emergency of international concern.
Okay, I would like to take your view on this. Considering what you know about, the outbreak, and the fact that we did not have consensus among, members of the committee, do you think this is a step in the right direction in terms of being proactive, or it's seemingly out of place in terms of just, raising fears from the WHO boss?
Well, it's a dicey thing, so to speak. He has a point. If he says he's been proactive, you cannot fault him for that. Some will say he's been proactive, some will say he's panicking.
Exactly.
But like they say, it is better safe
than never.
Than sorry,
rather.
You understand? Yeah. But my own view now is, so far in the history of
monkeypox,
between 2009 and 2020, there have been 7. These monkeypox will be the 7th public health event of international concern. The last one was the COVID-19 pandemic, and we barely recovered from that. So maybe some people would say he should have at least suspended or waited before declaring, since the whole world has not even recovered from the COVID-19 pandemic. Anyway, we cannot afford the world, or let me say 99% of economies of the world, especially Africa, cannot withstand another COVID-19 kind of event. You understand what I'm saying?
Yes.
The Western world will always find their way out. We know that, or can the third world countries do so? No. So some are saying it is political, while some are saying he's just being a medical person that he should be. So
Okay.
it's kind of a dicey situation, if you understand what I mean.
Okay.
But then self-peddling, wouldn't it pose a threat to vulnerable communities? Because we saw what happened with COVID-19. There was somehow, it was self-peddled, especially in African countries, Nigeria inclusive. So self-peddling, it may pose a threat. So probably the World Health Organization is trying to be proactive rather than being reactive when it has already spread so much that is now beyond what they could control. What do you think?
Do you want me to speak as a doctor, or do you want me to speak as Samson?
Well, you're a medical practitioner,
Samson
so...
has a different view from Dr. Shono.
Okay.
Dr. Shono will tell you, yes, not self-peddling, being aggressive in the management of any infectious disease is very, very good to prevent further spread. I believe that as a doctor. But as Samson, who has medical knowledge, I saw a lot of things that happened during the COVID pandemic, so to speak. I believe the COVID was not as infectious and as deadly as it was painted. You understand? COVID is still everywhere now. So what has changed? People are still dying, and everybody has gone back to their lives. You know, I don't want to start any political whatever. How come the way we were shouting about COVID, immediately the Ukraine-Russia war started, COVID just died down immediately. That alone has, you know, given rise to a lot of questions. What happened to COVID?
But
It just disappeared immediately after. So let's just leave that.
let me interrupt you there, please, doctor. Let me interrupt you there. That those who tell you that it didn't really go away. China still, you know, reported cases of COVID-19, even had to lock down Shanghai.
It has been in existence since the 60s. It causes common cold. Its death rate is very, very low.
Okay.
So one thing I discovered is if a person with if a person dies of stroke,
Okay.
and the person has COVID, they would report the cause of death as COVID and not the stroke. But meanwhile, if a person dies of stroke and the person has hepatitis B, which is also a virus, they will report the death as stroke in a patient with hepatitis B. So what makes COVID so special? Those are the things I see as a medical personnel that I do not agree with. You understand? Those are
Yes.
the technical aspects of the whole COVID that I don't agree with. But then again, what do I know? So back to this,
Monkeypox.
what's it called? The
Monkeypox.
monkeypox thing.
Yes.
It has been declared a GIC public health emergency of international concern.
Yes.
So far, it has spread to European countries and I think America. So yes, it requires a coordinated international response.
Okay.
Now, the funny thing now is there is really no cure for it. It's a viral illness that will run its course. You understand what I'm saying? So if they say educating people, letting people be aware, and you know, teaching people how to prevent it is their own way, is their own definition of coordinated international response. Then
Okay.
so be it.
Okay.
You understand what I'm saying? There's really no cure per se. Even the new vaccine that was going to have been developed, which is a modification of the smallpox vaccine,
Yes.
which, you know, the smallpox vaccine is similar. The smallpox is in the same family as the monkeypox.
Because of
So
symptoms,
some
yes.
said, yeah, some said the smallpox vaccine is a bit effective in
Yes.
preventing monkeypox as well. Now they modified the smallpox vaccine into one Ankara vaccine, and that has still not been shown to be effective. So far so good. There has really been no effective vaccine developed for monkeypox.
Okay.
Now, when the disease, hello.
I'm with you. Shoot.
So when the disease starts, the best you can do is to avoid contact with people. Mind you, this disease was discovered in 1958. The first case was reported in 1970. It has been endemic in West Africa and Central Africa. Endemic means it is in a particular area at a baseline level. You understand? Just like malaria is endemic in Nigeria.
Yes.
You understand
In
what
Africa,
I'm saying?
yeah.
And chicken, just smallpox is endemic in the UK. Is it smallpox or chickenpox? I'm not really too sure. Like endemic in the UK. You understand what I'm saying? So it has been here, but now that it has spread to international land,
Yes.
and it's spreading at a very fast rate. They said it requires a coordinated international response.
All right,
Okay.
Dr. Sampson, now you said the first case was reported in 1970, if I get you correctly, and then
The first case was reported in 1970, yes.
yeah, and then it was you mentioned 1980 something to 80.
No, 1968.
1968, okay. First discovered, the first case 1970, and then it was an endemic, but now it's been declared as something of an international concern. That means it's becoming, or rather it is now becoming a pandemic. So how do you think, what went wrong in the handling of something that was discovered in 1968 and was first reported in 1970, and now in 2022 it's now a pandemic? There should have been ways of handling it just so it doesn't spread across. So what do you think went wrong? Or did it resurface, or probably went away and resurfaced?
No, you can't say it resurfaced. It has always been there. Let me tell you, one thing that I've observed, people will say I'm a conspiracy theorist, but I see myself more as a reality. Anything that is in Africa, that is confined to Africa, is usually understudied, so to speak, or, what's this word? It's not really paid so much attention. I don't blame the international community, because we should be responsible for ourselves. This is how we handle ourselves that people would handle us. There's the Lassa fever that has been there in Borno that has been killing people like flies. But it has not spread to the international community, so nobody will say anything. The same thing with this monkeypox. It has been endemic. Although there are two strains, there's the West African strain and the Central African strain. The Central African strain is deadlier than the West African strain. It has always been in Nigeria, Cameroon, Liberia, and Republic of Congo. It has always been there. So there's nothing like it resurfacing.
So it's a case of being understudied.
For which to talk about how it spread, how it got there, we have to look at the ways through which it spread. We all know that the monkeypox is a zoonotic disease. What I mean is it can be spread to humans from animals. You understand?
Yes.
So it can be spread human to human and from animals to human. You get that is how they said the first reported case in the UK was from, I think it they weren't sure. They said it was suspected that the person traveled to Nigeria. And another thing is the spread is outside the endemic area, which is West Africa, Central Africa. Anywhere you find it outside, it is most likely from people in the gay community. They don't say gay anymore. The LGBT, what are those things again? LGBTQ. It's commoner. It's more common in the LGBTQ community. Those are especially men who have sex with men. So they said the person that brought it to the UK is most likely brought it from Nigeria to the UK. And we all know, all over the world now, men having sex with men is no longer a big deal. So people do their thing. And you cannot blame the health community in general for this spread, because the most difficult aspect of any process to handle or to control is the human factor. We all know this. You cannot tell human beings how to live their life. If a man wants to have sex with another man, you cannot stop that man. It is right. If he wants to have sex with animals, you cannot stop him. It is his right.
Okay. Okay, let's...
Apart from that, there is the importation of animals too, which is very, very common nowadays. You see people importing dogs here and there, importing cats here and there. Although it is said that it is the primates, the monkeys, the chimpanzees, and the rodents, the rats and co, that are most likely to pass the disease to humans. But then again, we all know humans can also pass it back to animals. The animals can pass it amongst themselves. A rodent can find its way to a cat or a dog, and the dog becomes infected. And once the dog becomes infected, it can pass it to humans.
Okay.
So the whole spread is a very complex thing. And like I said earlier, human beings are always responsible for whatever happens to them. So there's little the international health community or the local health community can do in this regard. Ordinarily put on face mask and wash your hands. we saw what happened during the coronavirus period. It is very difficult to control humans. So we cannot say it is the laxity of the health community, so to speak, that is responsible for the spread.
Okay, Dr. Sampson, let's look at it this way. Now that it's been declared as a public health international emergency concern, you said earlier that it requires coordinated response from the global community. These responses now, what would they be like? Will it be in terms of restrictions? Will it be in terms of more scientific studies and researches, and possibly coming up with a vaccine which is yet to be formulated or produced rather, because the last one is that of the smallpox, which is being modified to treat monkeypox. What are the coordinated responses that the people should look out for from countries in terms of dealing with monkeypox?
Well, I don't see any coordinated response that will be different from the previous public health, the previous global health emergency.
That's COVID-19?
Swine flu, especially the COVID, which it cannot be too different from the ones they did for COVID. The aim, no matter what they do, the aim will be to reduce spread.
Okay.
You understand what I'm saying? So,
yes.
And from what I've seen, the only way you can prevent if the spread of a viral illness is by first knowing how it is spread.
Okay.
Human to human spread is by direct contact. If you look at the symptoms, the fever, the headache, the symptoms are really non-specific except for the rash. And the only thing is the rash is actually non-specific as well. The rash looks like a pimple. People have pimples from time to time. Women have breakouts when they are when they are about to see their menses or when they are on their menses. Teenagers have breakouts when they are in puberty. People have breakouts if you don't wash your face for 1 or 2 days. You can have breakouts. If you change your cream, you can have breakouts. So it's just like a pimple on the face. But then it can be more specific if the pimples or if the rashes are inside of the mouth.
Okay.
And the chest. Then there's a swollen lymph nodes, muscle pain. But the thing is, it's a mix of symptoms. The rash may come before the other symptoms, and some people can experience only rash. But I think the rash is generally common to people with monkeypox. And some might have the monkeypox and not show any symptoms at all. But the good news is those ones cannot spread the disease.
Okay.
The ones that don't have any symptoms cannot spread the disease. So now back to the spread. Direct contact with the rash or body fluids of an infected person can lead to it. Sexual intercourse, kissing, and cuddling.
Okay.
Prolonged facial contact can spread it. Prolonged facial contact with an infected person can spread it. Cuddling and sex due to body fluids. You understand? Body fluids contact can spread it. Handling clothing or bedding of anyone that has been infected that has the disease.
Okay.
And pregnant women can spread it to their fetus. Now, it is not yet known if the semen or vaginal fluids have. Let me repeat that. It is not yet known if it can be transmitted through semen and vaginal fluids. The sex I mentioned is body fluids, kissing, there's no way you can have sex with someone and not be very close. The sex is more of a close contact thing than the semen or the vagina. You understand what I'm saying? Like I said, it can be spread from animals to humans. If an infected animal scratches or bites a human, you can get. Then if you eat infected meat or you use products from an infected animal, like the aspor and all those things, one can get it. So through that, knowing how something spread is like halfway. It's like it has got more than 60% or 70% of the job if you know how something spread. So I guess the international response now will be more of preventing the spread than producing a vaccine, which is very capital intensive. They will still produce a vaccine, but I think it will be more directed at covering the spread, the rate at which it spread. And the good thing is the death rate is really not as much. I think in the whole Western and Central Africa, the death rate is 4.4%, I think, also. Whereas in some regions, they tell you it's 1 to 3% of people that contracted the disease. that will die 1 to 3%.
Okay.
In some other they tell you up to 4.4%
Okay.
will die. Yes.
So apparently you've just informed us about the surface contact. You've also talked about the possibility of contacting this from body fluids, among others. Let's look at issues of overcrowding. I read somewhere that overcrowding as well could bring about possible contact. How possible is this, or how true is this rather? And then what are the measures you would suggest individuals should adopt to try as much as possible to prevent the transmission?
Transmission from overcrowding?
No, what I'm saying, I asked two questions. The first is, overcrowding, is that also a source of transmitting this? Is that a possible means of transmitting this?
Yeah. In any infectious disease, overcrowding now, of course, now that one is logical.
Okay.
Overcrowding anywhere will lead to will make direct contact very much possible.
Okay.
It will increase the probability of spread through direct contact. It's even worse if the disease is a respiratory thing. You understand what I'm saying?
Yes.
It will be so overcrowding will really speed up. So in densely populated areas, the likelihood of spread of an infectious disease is increased. That one is standard. One doesn't even need to be a doctor to even know, a medical personnel to know that. I think it's a logical thing. You understand what I'm saying? So overcrowding, yes, you're very, very correct.
Okay.
Your second question, please.
Okay, now let's look at you mentioned earlier that for monkeypox there's currently no cure for it. So for people who have one way or the other contacted it, what can they do, and how long is it? A duration of time it runs to and it clears, just as chickenpox runs for a period of time, then it clears off, or it's a death sentence on its own?
2 to 4 weeks.
2 to 4 weeks.
Yes, the disease runs for like 2 to 4 weeks.
Okay, then after that it clears totally.
Yes.
Are there cases of? Can there be cases of death?
I spoke about that earlier.
Okay.
1 to 3% for people who may need to be. The severity of the symptoms differs depending on your immune system. You understand? And viral diseases generally don't really have a cure. They may be treated, but they do not really have a cure like that. So once the symptoms are severe and the person gets to the hospital, they give IV fluids and all. There are some antivirals that they may prescribe, but generally it really doesn't have a cure. You hear what I'm saying? So,
okay. Since you said it doesn't have a cure, you just mentioned antivirals for treatment. What other ways can you treat monkeypox?
Hospital admission.
Okay.
If the rashes are already in, you can have a viral illness, and then which might bring down your immune system, and you might have other bacterial infections as well.
Exactly.
So you give painkillers, since the person has fever, headache, you give painkillers, and you can give antibiotics if indicated, and you give the person body fluid, IV intravenous fluid, which we call drip in Nigeria as the name may be. But to talk about the prevention as well, how do we prevent it? For people who already have it, you just isolate yourself and you stay away from other people, just like the COVID virus.
Okay.
You understand? Just like COVID-19. Now, for people in general, just avoid close skin-to-skin contact with people who have suspicious-looking rash.
Okay.
You understand? No kissing, no hugging, no sex, no cuddling, no sharing of eating utensils.
Okay.
Do not handle beddings so well, or clothing of infected people.
Okay.
Then general soap and water cleanliness. You use soap and water to wash your hands as many as possible. You use alcohol-based hand sanitizers, just like in COVID. You avoid contact with animals that can spread.
Okay.
Although we say it's usually the primates. We all know what the primates are now.
Yes.
The animals that look like human beings but are not human beings, and rodents. But then again, now still suspect cats and dogs,
Okay.
Cats and dogs come in contact with other animals, and they must have come in contact with other human beings too that have it, And the way people import dogs and everything, the way people import animals across the globe these days, the rate has really gone up. The rate at which people import animals, the rate at which people move animals around the world these days. We all know how dog business has been booming in Nigeria, and also we have avoid contact with animals, especially in an endemic area.
Okay.
You understand what I'm saying? So that is just it.
Okay. Thank you very much.
Before I go, they said there's a vaccine.
Okay.
You understand? And there's a list of people who they feel should be vaccinated. People who have been identified by public health professionals
Okay.
as having the disease. People who have had multiple sexual partners in an endemic area, especially those in the LGBTQ community who have multiple sex partners.
Okay.
And people whose jobs may have exposed them, like the public health workers, the healthcare providers, and people who work in laboratories where you test for such viruses.
Okay.
They test for the DNA of how they test for the virus by taking samples from the rash and testing for its DNA. You understand what I'm saying?
Yes.
So those sort of people should be vaccinated. I think I remember this earlier that they said the smallpox vaccine has some effect against
monkeypox.
Yeah, and I also mentioned that they modified the smallpox vaccine. I think they call that Ankara vaccine.
Yeah.
That has been shown, not shown to have more effect
than others. Okay.
Yeah, that's it.
All right,
Thank you very
so
much, Dr. Sampson.
Thank you.
It's a pleasure having you on the show. Tk you so much.
Say hi to Margaret for me.
Hi, Dr. Sampson. Thank you. I can hear you very well. We appreciate you. Thank you so much.
Oh, you're welcome.
All right. Well, that was Dr. Sampson Shonowo, the medical director of Shonowo Hospital, and shedding more light on the monkeypox prevention method, treatment method, although there's been no scientific treatment for it, but then we can always avoid it, and boost immune system is very, very important. We'll take a short break now. We have more interesting segments for you on the show this morning. Please stay with us.